Okay, thanks. So I'm Roya Marie, Radiation Oncology Fellow at Liverpool Hospital. Evidence-based estimates have reported an optimal radiotherapy utilisation rate to be 87% in cancer patients in an updated Australian report that was published in 2012. However, the current radiotherapy utilisation rate in New South Wales for breast cancer is unknown. So the aim of this study was to obtain the current actual radiotherapy utilisation rate and compare that to the optimal, and also try and identify factors that impact on underutilisation or possibly overuse of radiotherapy, and the impact of that on patient outcomes in terms of local control and overall survival. So this study was done through identifying breast cancer cases between 2009 to 2011 from the New South Wales Clinical Cancer Registry, and these were linked to data extract from all public and private radiation oncology departments. And then univariate and multivariate analyses were performed to identify potential patient, tumour and treatment factors that impact on radiotherapy utilisation. Then overall survival and local control shortfall in person number, and this is defined as the number of patients not achieving local control and survival benefit due to radiotherapy underutilisation. We were able to calculate these numbers as well. So there were 13,193 cases of breast cancer diagnosed in New South Wales between 2009 and 2011, and the actual radiotherapy utilisation rate for this cohort of patients was 59%, which is much less than the optimal rate that we would expect it to be at 87%. On the univariate analysis, multiple patient tumour and treatment factors were all significant and impacted on radiotherapy utilisation. On the multivariate regression model, the main factors that remained significant were as listed here: distance from treatment centre, older age, and smaller tumour size. On this graph on the side, just gives an example. In the first column, we've got patients who are less than 60-year-old and live less than 100 kilometres away from a radiotherapy department centre. The radiotherapy utilisation for this group of patients, for example, was 68%. On the other extreme of the graph, that kind of drops to almost half for patients who are older than 60 and live more than 100 kilometres away, despite the fact that both groups of patients have the similar indications for radiotherapy. In terms of impact on local control and overall survival, underutilisation of radiotherapy resulted in potential 85 patients losing survival and 637 patients with local regional failure due to underutilisation of radiotherapy. These numbers were based on calculations that were compared to numbers of patients achieving local control and survival benefit in the optimal setting, and these were published this year in the Green Journal. So as we can see, underuse of radiotherapy has resulted on negative impact on patient outcomes, and together with identifying the factors that contribute to underutilisation, we could say that these data should help with health service planning and also calls for better adherence for treatment guidelines. Thank you.
Thank you very much, Roya. That was really interesting and seems quite impactful in terms of what you've managed to find.
Thank you.
Does anybody have any questions for Roya? It's back to me. I was just wondering about the patient age and distance factors. I wondered if you knew of any literature or whether there were any plans to go and understand why patients of a certain age were declining or not adhering to this treatment as well as others.
I think on their own age and distance, it's well known in the literature that they have big impact on radiotherapy utilisation with older age, meaning less chance of having radiotherapy, and being further away from a treatment centre also impacts on radiotherapy utilisation, and that was published by Gabriel a few years ago. that showed that living more than 100 kilometres away impacts. But what's unknown is really relationship of both factors together on the radiotherapy utilisation. So obviously they have like an additive effect. If you're younger and live closer, you're more likely to have radiotherapy compared to if you're older and further away.
And are there any particular interventions that can help with that combination of factors that a person might have?
Sorry, what's the first part? I didn't.
Are there any particular interventions that would be helpful for somebody who is older and lives further away?
So I think that's why we concluded that it's really health service planning, which has already been, worked on with, and we've seen increasing number of radiotherapy departments increases their utilization rate, and also adherence to treatment guidelines. So even if they're older, we know that there's a certain percentage of patients that they would still require radiotherapy regardless of their age. So just adhering to treatment guidelines would improve that.
Yeah, I guess the question is how we get them there, isn't it? How we get them to adhere.
Multidisciplinary kind of input and patient referral patterns has to be looked at as well. Make sure that GPs refer to multidisciplinary teams, referrals from the surgeons as well. So,
okay, thank you.
Thank you.